Hi everyone, welcome to Micro Mahasutra, and we are discussing the serious and bloodstream infections, and this is the time to discuss the very important fungus in the bloodstream, that is Candida. Candida is very important, okay? And one important thing which always come to my mind whenever I study Candida is can. So my dear friends, if you have your can, that means I can and I will, then definitely you are going to win. And here our team is there to make your dreams come true. Yes, you can, yes, we can, and yes, we will win for sure. Coming on to Candida, I always say this thing whenever you are studying something. For example, now you are studying Candida with us, please visit our general mycology video, because that will make you aware of how the general of all fungus goes on. So Candida per se, if I talk about, Candida is endogenous, that's the part of the normal flora. Okay, what are the predisposing factors that leads to increase in Candida? So if the CMI is cell mediated immunity is decreased, then Candida can flourish, or some other conditions where the immunity is less, say diabetes, steroid therapy, transplant, pregnancy, radiation, HIV, your immunity is compromised. So the Candida levels are going to increase. Candida, although can be there in multiple forms, but the most common one is Candida albicans and Candida non-albicans. Albino word means white. So Candida albicans is of white color, Candida non-albicans non-white. For example, Candida tropicalis, Candida glabrata, okay, all these things. Now, how will you differentiate between them? In order to differentiate between them, you will do a test which is called as germ tube test. What is this germ tube test? My dear friends, I have already told you in the general mycology class that Candida lives in pseudohyphae. That means although it is a yeast form, but there will be budding, and the budding is not going to get separated from the parent cell. So this becomes a pseudohyphae at 20 degrees Celsius. But at higher temperature, it forms germ tube. So it is going to form a tube that is called as germ tube. But in order to form the germ tube, it requires some proteins. Okay. In order to form the germ tube, it requires some proteins which are present in rabbit serum. Okay, my dear friends. Now please understand, in order to differentiate between Candida albicans and non-albicans, we do this germ tube test. What we do, I pick up the Candida, I put the Candida in rabbit serum, and then I leave it and incubate it for 2 hours. After that, I observe if the germ tube is coming out of it or not. If it is coming out, it can be Candida albicans and Candida dublinensis. But if it is not coming out, it is non-albicans Candida. You got it? So what I did, I took the Candida, I put in a jar which was containing the rabbit serum. After that, I left it for 2 hours. After 2 hours, when I saw the germ tube was there. So now it can be two situations, either Candida albicans or Candida dublinensis. So how to differentiate between them? So remember, Candida albicans is germ tube positive. Candida dublinensis is also germ tube positive, but please remember that at 42 degrees Celsius, remember this is very important. At 42 degrees Celsius, albicans is going to grow, but dublinensis does not grow. So remember, D dublinensis, D does not grow at 42. Okay, you got it? Dublinensis is not going to grow, whereas albicans is going to grow. So at 42 degrees Celsius, albicans is going to grow, dublinensis does not grow. And one thing which is very sure, because the germ test is positive, this is going to be these both. If the germ test is negative, then it is going to be non-albicans. Okay. Coming on to clinical feature, what can Candida go and do? Candida can do oral thrush. The tongue can be coated with Candida, white. Candida can cause esophageal candidiasis. In esophagus it can go. I have got some beautiful, okay, see the picture of germ tube, see the tube is coming out, okay, right. See, this is the esophagus and this is my Candida. Can you see, this is the Candida. So, Candida esophagitis, the white one. So, white one, so Candida albicans. Okay. So, it can go and cause oral thrush, it can cause esophageal candidiasis, it can even cause vaginal candidiasis. Okay. Others, it can cause perianal or cutaneous or systemic. Please remember, candidiasis is also called as moniliasis. So, candidiasis and moniliasis are same. How it is going to transmit? Baba, I have told you, this is endogenous. This is going to be there inside your body always. But whenever opportunity comes, the level are going to rise. Okay, right. Now, one important thing, please remember, there is a statement which was asked in one of the previous questions, previous year questions. The statement says that all the systemic infections are opportunistic infections. Rather, the statement was all the fungal systemic infections are opportunistic infections, and the answer was not. See, I will tell you. So, systemic infection means which involve multiple system. For example, Cryptococcus, for example, Candida. So, please understand that Candida is a systemic infection. So, Candida is an opportunistic infection, but not all the systemic infections are opportunistic infection. For example, Cryptococcus, although it is a systemic infection, but Cryptococcus is not an opportunistic infection. Okay? Yes. How will you diagnose it? So, wherever you see there is Candida, you will scrape the things. For example, from tongue, from esophagus, from vagina, you do a biopsy, and once you do the biopsy, you will see a pseudohyphae, I have told you, and budding yeast cells. Definitely this will be seen. Other thing, you can use the culture media like SDA, Seborrheic dextrose agar, cornmeal media, Cled media. Cled media I have told you in a distinguishing media in the general microbiology class. But how to remember? Remember C for Candida. Okay. So, C is Cled media, C is cornmeal media. Okay. So, Candida. Okay. DA, this is DA is important. Why? Because the media is SDA, Seborrheic dextrose agar. Other tests, obviously ELISA, PCR you do. And treatment, for example, if it is a mild Candida, you will do fluconazole. Okay. How to remember? If there are few Candida only, then it is a mild disease, the treatment is fluconazole. Okay. If it is aggressive, that means if it is severe, then you will give amphotericin B. If it is severe, then you will give amphotericin B. And topically, what you can apply? You can apply nystatin. Okay. Topical application, nystatin. One important thing we should add is if normal amount of Candida is seen, it is normal flora, my dear friends. Okay. But if you are having pseudohyphae, so normally this is the Candida, normally. But if it is increasing, that means some immune deficiency, so that's why it is increasing, and once it increases, it forms the pseudohyphae, as I have told you. So, this pseudohyphae means that this is going to invade now. This is invasive candidiasis, because normally they exist like this in a yeast form. So, if they are dividing multiplying continuously, dividing continuously, that means a lot of Candida is being produced. That means it is invasive candidiasis. Okay. Coming on to some important things just now, whatever I have told you. See, remember, Candida is responsible for causing the oral thrush inside the tongue, right? On the tongue, it is causing the thrush. So, that is not a AIDS defining feature, because that is considered to be mild. Okay. Some people who are who inhale the steroids, just like asthmatic people, no, they inhale karke from their tongue. So, they have got low immunity in their mouth, so they might get oral thrush. But remember, if the esophagitis is happening, that is a AIDS defining illness. That means some big thing is happening just like AIDS. Okay. So you should know that. Okay, clear? And please remember the important thing is in the vaginitis, whenever there is vaginal infection, there is itching which is going to happen, there is secretion which is going to happen, which is copious in amount obviously, and there is a cottage cheese appearance which is there with the candida. So C for candida, C for cottage cheese, C for copious. Okay, so candida has got copious secretions, cottage cheese, and yes, itching is going to be there. Okay, this is important and you have to know that. Okay, yes. And one more important thing, please understand, oral thrush which presents with white plaques can be removed. Please understand, it can be removed away. So C for candida, again I am writing C for candida, C for can be removed. But if it is a disease like EBV, Epstein-Barr virus, white plaques will be there on the side of the tongue which cannot be scraped off. Okay, so can be scraped off is candida, cannot be is going to be EBV infection. Okay, so thank you so much. This is end of our session in the fungus. We will end up the CVS and bloodstream with one more lecture, the next lecture, that is going to be pyrexia of unknown origin. Make sure you watch it. Thank you so much.